The maternity place at Broward Health Coral Springs offers high-quality, personalized obstetric and Level 2 neonatal care. All new private suites and comprehensive support services for both mother and baby are just a few of the unique amenities. The all-private suite NICU is located steps away from Mom Suite. Broward Health Coral Springs has a long-standing history and commitment to the community. When looking for high-quality, compassionate care, you can depend on Broward Health Coral Springs.
Next, we have Broward Health Coral Springs on Coral Hills Drive in Coral Springs. All right, let's get into it. 11 months ago, my son was brought in by EMS, and what a horrible experience from the time they came to the unprofessional and uncaring treatment of your staff and doctors in the ER. Doctor never bothered to even come in room to examine him. Brought in from having a seizure and had 3 more while in room in the ER. His O2 dropped to 62. And I went to inform someone, and they said that's nothing. His heart rate hit 212, was admitted, and most of the care there was just as bad. Found out his sodium level was critical, 116, and could have went into a coma and even death. What if it was one of their family members? Would they have gotten treated like that? Never heard anything about the CT, and they should have done an MRI of the brain to see how bad it swelled. They then raised sodium too fast and then tried to correct that. Now this could cause major problems from now on. If I was you, I definitely would go elsewhere. Also, BP was 230 over 132. Never got to see a cardiologist, neurologist, or urologist. Wow, and they have pictures of the heart rate and everything. Jeez, his O2 level. We regret your expectations were not met. A little bit of a different response. But yeah, this is in the same network as the first Broward County Health Center that we went over. This is just their Coral Springs hospital. All right, let's see. A month ago. If I could give it negative stars, I would. Never ever in my 40 years of living here have I seen and been to a hospital this terrible. My boyfriend made the mistake of coming here. He was admitted and was told he can't shower. He can only wash up because there's an issue with the shower. The AC in the room was broken, and we were told they can't fix it unless the room was cleared out, which it can't be with 2 patients inside. They just have to sit here and sweat, I guess. For days, I've been here 10 hours a day sitting at the edge of his bed because not until today, day 4, did someone offer to bring me a chair to sit in. The lack of communication amongst the staff is unreal. We've had nurses almost give him the same meds twice from the lack of communication. The nurse and doctors are rude AF. The food is disgusting. He was supposed to have a procedure done yesterday that was canceled because the staff forgot that he needed to fast for the procedure and gave him food. He has been taken to do tests that he did not need, and when he got there to do the tests, was told it was the wrong patient. The nurse missed some of the meds she was supposed to give, and all she had to say was, "Oh, I must have missed that one." Like it was no big deal. They had him fasting over 15 hours for a procedure that was supposed to be done hours ago. At this point, he is going to sign himself out and go to another hospital. Wasted 4 days in this dump. Won't spend another. I do not recommend. We are sorry you feel this way. Let's see what else we have. A year ago, with photos. Worst hospital, stay away. My husband was given sheets with bloodstains on it. Blood that was not his. The food tray was sticky and nasty to the touch. How is one to regain their appetite using this? The curtain dividing the room had stains on it, presumably stains that look like blood. Extremely unsightly, turning your head, not feeling well to see this. The nightstand was falling apart. Chips were falling off when it was touched or anything was placed on it. Simply answering the phone caused chips to fall off the nightstand. The shower head holder was broken in his bathroom. Patients are expected to shower holding the shower head. Garbage was left on the floor next to the trash can for 2 days. My husband watched the cleaning lady empty the trash can and disregard the trash on the floor. Guest relations is a joke, showed no empathy to our concerns. Jocelyn Feliz claims the food trays are supposed to be sticky. And Summer Marrero seemed bothered by my complaints. Oh, wow. We appreciate you reaching out to our CEO, who will be investigating your concerns as well. We wish you and your family the best of health, and please let us know if we may be of service. 6 months ago, under no circumstances should you use this hospital. I went on 4/26/22. They did a bunch of tests through the emergency room, and I needed to be admitted, but they would not accept my insurance. They did not notify me that my insurance until after they had done the test and advised me that if I wanted to be admitted, I must sign a form accepting all financial liability for anything that happened at the hospital and agree to pay it in full because my insurance would not be accepted. I declined and went to HCA Northwest Medical Center, who did accept my insurance and was admitted and had everything done at that hospital. I complained to this hospital that They should have advised me or had something posted to let me know that my insurance would not be accepted so that I would be able to make the decision to stay or leave as I decided. That choice was taken from me, and now they are billing me for everything as out of network and expect me to pay for everything, though the work that they did was not used for anything, and all the tests had to be redone at other hospital prior to my being admitted. This hospital does not care about you, only about your money, so do not use this hospital. 8 months ago. Please don't go here if you're looking for actual care. I wouldn't wish this place on my worst enemy. I went here myself recently and waited 2 hours in the ER with severe pain just to leave and go to an urgent care to actually get service. I also had a family member who went here recently just to come back home, worse than when she originally left. The communication is horrible with the staff. The service is just the worst. And it's not my problem attitude is just the icing on the cake. There used to be there used to be a time I trusted in the medical system, and now you're simple just another insurance claim. I wouldn't go here even if I was dying. Just let me meet my maker at that point. Do yourself and your loved ones a favor. Do not go to this hospital. You were warned. If you truly have to go to a hospital, Holy Cross, highly recommended. 7 months ago. Holy cow. I genuinely and highly suggest taking your loved ones to another hospital. Unless you have absolutely no alternative, the quality of care and the bedside manner from the hospital staff is significantly inadequate and combative. My grandfather came in on February 1st, and as of February 12th, has consistently received subpar patient care. My grandfather is battling aggressive prostate cancer and is currently being seen at this hospital, and every time I come to visit him, I'm without fail heartbroken to see the state he's in. Each time I've come to visit him, he's wet, cold, and laying in urine-soaked sheets and blankets due to catheter malfunctions. He's complaining of not being changed or moved or heard. I started addressing my concerns to the staff February 2nd, 2023, outside of Dr. Castellanos, who did take the time to truly hear me, and Nurse Winnie, who was the only staff to show true compassion and a standard of quality care every patient deserves. Each request for a higher standard of care is met with defensiveness. When a transfer request was made to have him moved to a surrounding hospital, Angela, a case manager, was immediately defensive and began questioning my reasonings. Gratefully, Cindy, another case manager, saw that the imbalance of the situation and stepped in. Cindy assured me she would do all she could to address my concerns and begin the transfer process. Days passed, and Cindy informed my family that every hospital had denied the transfer request. The lackluster care continued, and the overall experience unfortunately worsened with time. My mother, who lives in North Carolina, and my aunt, who lives in Georgia, both had to take off from work and fly in to assist me with advocating for my grandfather. This seemed to make matters worse. Karen, the patient care assistant on the third floor surgical, was the least sympathetic and most unprofessional of all, and ultimately led to this review and the formal complaint I'll be drafting and submitting. Karen took each concern brought to her attention as a personal attack. When I asked her for a nurse or a doctor to give me an update on his treatment plan, she told me to ask my grandfather. He can talk. I informed her that it wasn't his responsibility to update me on matters that he was too sick to fully grasp, and that I had asked him as much as I could, but still had many questions he didn't know the answer to. At this point, she said she'd send someone over. While we were waiting, my family took it upon ourselves to change his wet sheets and bloody hospital gown, readjust him, and help him eat. Unfortunately, Karen returned, and the unwarranted aggression continued. She interjected herself into a family discussion about the quality of care, and some have became the victim in the situation, and went as far as informing my family, myself, mother, aunt, and sister, that she wouldn't be losing her peace for anyone today, and I advised that I had a nasty attitude. I informed her that our frustrations were warranted and that my valid concerns of the continually poor quality of care weren't directly solely at her, but the staff as a collective, and informed her that she didn't know me well enough to accuse me of having a nasty attitude, to which she replied, "And I don't want to know you." At this point, I realized her lack of empathy in conjunction with her defensiveness wouldn't allow for a productive conversation. The best thing I could do for my loved one was again try to have him move to a different hospital. The care is so poor here, my family is currently looking to have his discharge against medical advice just so we can immediately move to a facility where we can be confident in the care he receives in our absence. Jeez, dirty. For all the nurses in February. Truly regret the experience as shared. If not already done so, okay. 8 months ago. First time I came here, I did not have to wait. I am 8 weeks pregnant with gallbladder issues. Second time the next day, I was having a false miscarriage and they made me wait 3 hours. They sent me home. Today, I'm coming back because of my gallbladder, and I have waited 5 hours, and they told me it would be another 2 or 3 hours to be seen. No help, no relief. Just two ladies telling me I'm not as important and must wait for a room. In the meantime, there are other people being seen that came in way after me. I am pregnant. My gallbladder is exploding. If I could move and drive myself, I would have looked for another place tonight. Very upset. I'm still waiting and it's been over 6 hours. Are they totally for real? I am pregnant and almost had a miscarriage yesterday. No one cares. Update. Been here since 12:30 a.m. It's now 7:30 and still waiting. I wish they would care. Going into hour 8 now. 8 months ago. This is the worst ER you can ever go to. Nurse Christine is rude and beyond unprofessional. After waiting 2 hours for a room, not a single nurse came in the room to assess for 45 minutes. And when I went calmly to the nurse's station to ask what's going on and state that not a single person has come to let me know what's going on or even assess me, Christine, the nurse, told me to stop yelling at her. Never once did I raise my voice. I voiced my problem that I am having since no one came to check and assess. Christine then called security and told them I screamed at her and recorded it on my phone, none of which is true. This hospital is a joke, and the fact they hire nurses like that are very unprofessional. Apparently, being a sick patient and wanting to find out when a nurse is going to help me requires for security to be called and lies to be told by Christine the nurse. God forbid I go to the ER for help and want to know why no one is helping me. 10 months ago. This is a review against the nursing staff regarding the poor care and mistreatment of my mother-in-law on November 6, 2022. My mother-in-law was transferred from the emergency to the cardiac care unit on the 4th floor. The orderly placed her on the bed in an uncomfortable position. She could not be moved by the orderly because of the severe pain that she was involved in, as well as severe discomfort on the side of her chest. The initial positioning on the bed would have been uncomfortable for anyone, much less a heart patient in severe pain. Upon her arrival, there was no one there to receive my mother-in-law in her newly assigned room and make her comfortable upon arrival. She was not checked in and properly received by the staff. I waited for 30 minutes for some type of care to be rendered to my mother-in-law. My mother-in-law laid in her bed in agony. If it wasn't for my insistence, she would not have gotten any care at all. I asked 3 various staff members for a pillow to make my mother-in-law comfortable. She never received a pillow. Secondly, my mother-in-law was in severe pain, and I asked that she be treated for the pain. No one checked in on her, checked her vitals, or attached any monitoring equipment to her, as my mother-in-law is a heart patient. The tray table in the room was disgusting, a sticky mess with pieces that appeared to be old food particles on the surface of the table. Upon arrival, my mother-in-law didn't receive any towels or bedside accessories. It only wasn't until I waited 30 minutes that I told the change nurse that I'll be filing a complaint against her and the staff on the floor for my mother-in-law's mistreatment that finally motivated her and her staff to attend to her. 2 pillows and new linen appeared, a nurse's aide, and the charge nurse finally rendered care. My mother-in-law should have received adequate care and respect upon her arrival into her room. It shouldn't take the threat of a complaint against the charge nurse and her staff for her to have received proper care. I feel the lack of care rendered by the hospital staff disgusting, and I was terribly distressed over the discomfort and lack of care that my mother-in-law received. I wouldn't want a dog mistreated like my mother-in-law was upon her arrival into her room. The lack of treatment and care was inexcusable and unacceptable. I doubt any action will be taken against any of the staff. I can only hope that maybe others won't have the same miserable experience. Just take a look at all the terrible reviews of this place. 10 months ago, I was told my ultrasound results were clear by Dr. Ruiz in the ER. They were not. Dr. Ruiz also told me before discharging me this is exactly how I would treat my family. Huge red flag for me. I went to a different hospital that properly diagnosed me. I was misdiagnosed here, and when I complained, they opened an investigation. The investigation concluded I was contacted by the medical director, who only apologized for the doctor misdiagnosing and lying to me about my results. Do not recommend this ER. A year ago. I want to start off by saying I am completely unsatisfied with this place. I waited 4 hours, not exaggerating, 4 hours. I got there at 9:30, and by 1 a.m. I was still waiting in the waiting area. The entire time, they called people who came in after me. The receptionist is beyond rude. If you ask her for a wait time, she will say, "Go ask the nurse," and shoo you away as if the nurse isn't with another patient taking vitals. There are sick people throwing up in barf bags in the middle of the floor, making gag noises, and all of the nurses are walking past as if it was normal. When asking the attending nurse how long the wait would be, she said, "You're next, we have no beds." As I sat and watched 6 other people who checked in after me get called before me. If I could give this place 0 stars, I would. Lack of care and attention from the staff who have sick patients waiting to be seen. Would not recommend this place. A year ago. If you can go to another hospital, just do that. Came in at 19 weeks pregnant with a severe UTI, as they stated, and had to be admitted overnight as I was moved from the ER to the 3rd floor. I should never have agreed to stay overnight. The staff on the 3rd floor east were very incompetent. Couldn't answer simple questions, and I didn't receive any more antibiotics while I was upstairs. I pressed my call bell twice for my nurse or any nurse and only got a PCP that couldn't answer my that couldn't answer my questions come to my room. The second time, I had to call the hospital from my phone to get the charge nurse for that floor to come see me. What was the point to keep me overnight if I was going to be treated and wouldn't receive satisfactory care? Like I say, if you can go elsewhere, do that. This is also one of the dirtiest hospitals I've ever been to since Jackson South. I don't even see why or how they're part of Broward Health Network. 1 star is me being generous. This hospital and the staff deserve 0 stars. I won't be back. A year ago, went to the hospital because I had abdominal pain. I also had back pain, but the abdominal pain was the reason I was there. Sat in the uncomfortable chairs for over 3.5 hours and still was not being seen. The triage nurse seemed to be spiteful and therefore send 5 people who came after me in. My last time at this emergency room. Don't use this emergency room. If I wasn't hurting and needed the care, I would leave just like many others who left a year ago. My son was brought here with horrible pain. They kept him here multiple days, diagnosed with a severe colitis. The problem came with pain management. Literally every 3 hours, my son was screaming in pain, and we had to fight with nurses and doctors to get his pain managed. Every 3 hours, they let his pain spike to a 10, his body convulsing and blacking out. They made him wait in the name of the doctor's orders. Every time we asked to speak with pain management team, we were put off and told they would call them. When they did show up a day later, they told us one thing and they did another. The nurse informed us that they changed orders after we talked to them and cut his meds in half. This has been hands down the worst experience ever. Sitting in the hospital room with my child screaming for someone to please help him, and have to fight to get someone in here. He has a serious disease that is extremely painful, and they were uncaring and horrible. Nurses were sympathetic and kind, but higher ups had the power and they were unwilling to help. Nurses were helpless to help us. 0 stars is too many. 11 months ago, waited 3.5 hours with pain. When I decided to leave, the personnel did not show compassion. Please do not go here. I decided to come to an emergency room at 441 West Boca Medical Center. An ultrasound of my leg was done in 10 minutes after I crossed the door. In Broward Health, waiting 3.5 hours to be seen and never happened. Huge difference. Do not put your life in jeopardy. A year ago, the ER here is really substandard. Twice I have gone in and neither time did the MD examine me. They rely on blood work and x-rays only, and if those are fine, they send you home. As a medical doctor myself, I don't know what a complete ER history and physical entails, and they don't do either. I also wanted to read a document before I signed it, and there was no way for me to read it. The staff member seemed to not understand the concept of informed consent or the rights of the patients. The staff ignores you even when there is virtually no one in the ER. Find a better one, or you will be wasting your time and not getting a thorough assessment. 3 years ago. Well, I went to the hospital Thursday afternoon for pain. I had a wonderful experience in the ER. The doctor, nurses, and specialists were extremely caring and definitely listened to any I had to say. They constantly checked up on me to make sure I was okay. Ended up having to stay over 2 nights as I had to have surgery. The minute I went upstairs to an overnight room, I was treated like an inconvenience. One nurse didn't want to give me the full dose of my medicine after the doctor clearly told me what dose. She gave me half, and when I asked her about it, she didn't say anything, just walked out of the room. I had to call every 4 to 5 hours for medicine and had to wait over an hour to get it every time. And when I thought to call earlier for it so I would get it before the pain was unbearable, I was told to wait. Also, I had an allergic reaction to my medicine and told my nurse I was not going to take that again. She tried to give it to me and said she can give me something else on top of it for the allergic reaction. I asked her to talk to the doctor or pharmacy for something different since the reaction was bad and she gave me the worst attitude. I couldn't even talk to my nurses about my pain. I just wanted to leave. Mind you, I'm in serious pain waiting to have surgery. I've also had great experience at this hospital since I was very young, so to me this was a very big shock to be treated this poorly. I will not be coming to this hospital again. I'm so upset about this experience.
I find that the staff here, once they come here to work, they're here to stay for 20, 30 years. And I can see why, because it's one of the smaller facilities, so it does have a more intimate feeling. It's a comfortable environment. Everybody supports each other.
When you come in at Coral Springs, you have a wonderful training. I have a chance to rotate everywhere: triage, resuscitation room, again peds. Also, I have a chance to work as a charge nurse as well. If you want to work everywhere, if you are looking for experience, yes, you will get that at Coral Springs.
I had 3 months of training, got exposure to different procedures. They wanted to make sure you either saw a procedure or talked thoroughly about it, and they made sure that I was comfortable, that I was with competent people, and I was provided information and a lot of support.
2 years ago. I'm giving 1 star because of the mother's clinic, brand new with brand new nurses, fresh out of nursing school with no experience with labor or delivery. Jenny was my issues nurse, didn't know how to proper pelvic exam, and her bedside manners was poor. I eventually asked for another nurse with more experience. At this time, the baby was already crowning. I delivered with no doctor. Dr. Mogg was on call. I only saw the doctor approximately 20 minutes after delivering my baby. I wait with the placenta and clamps still attached. Very horrible experience as a first-time mommy. I'm writing this letter because it's almost a year and I'm still having issues with the perineal that was torn. Damn, that's like a major fuck up. Okay, a year ago. My son had surgery yesterday and everything was well until after surgery. The nurses are way too rough on kids. They literally held down my son so hard to the bed and covered his nose for him to swallow some medicine right after surgery. My son was kicking and struggling because he could not breathe due to them covering his nose. At the end, spit out the medicine. If this is their way, like they said, of giving medicine to the kids, I feel bad for the younger kids. My son is 7. My son was in pain and was drowsy, of course, refused to take medicine after surgery, but they forced it down. Today, my son is extremely sore from his arms and neck because of how tight those heartless nurses held him down. Unfortunately, my son is due for another procedure in 6 months, and I pray that we get different nurses this time. As a mom, I feel like I should have spoken up. Please don't let the nurses force anything on your kids. A year ago. Spent 6 hours at the ER and they did absolutely nothing for me. Let's start by saying I'm 25 weeks pregnant. I went to the ER asking to be seen at labor and delivery because I was having pre-eclampsia symptoms. I was having a headache that wouldn't go away for 3 days, blurred vision, and high blood pressure. They told me because I didn't have any pain in my belly, I had to wait at the ER. Hours passed, and I complained that I was feeling like I was going to faint and I was feeling cramping. They said I needed to wait. Finally, after hours, I was put in the hallway. The rooms in the hallway I was in were emptied and then filled by other people, despite me asking 3 different staff members to please put me in a room. I was told the rooms weren't any safer than the hallway. After waiting for my results, they tell me they see nothing wrong with me but to be on bed rest till I see my OB and that my urine might be dirty, but they don't want to do anything about it because I need to wait to see my OB because he's the specialist, not them. So I wasted 6 hours of my life and nothing was accomplished. I didn't receive any treatment and I left feeling just as bad, if not worse, than when I got there. Oh, almost forgot. I was handed a blanket after hours of being in the hallway and the blanket had green snot on it. I was handed a dirty blanket. Do not go to this ER. They are awful. A year ago. This hospital has a Karen in the emergency room by the name of Nurse Jenny. She was extremely rude, no compassion for my pain and weakness. Her words were harsh, and I had no energy to respond. She attacked me verbally when I was at my weakest. I do not recommend any African Americans go to this hospital. If she had the power to let me die, I believe with all my heart she would kill me. What happened to the nurturing and caring nurses? What happened to humanity? 2 years ago. I am posting and taking the time to write this out only because of how heartbroken and disappointed I am over this situation, hoping that this does not happen to anyone else. 2 weeks ago, I went to Broward Health Coral Springs with severe abdominal pain. Surgeon requested I have an MRI for diagnostic purposes. When the tech came to get me with the wheelchair, she asked me to remove all my jewelry, that it was not allowed in procedure. I have never taken off my wedding rings, but this was a special situation, so I complied. I had a hard time taking them off, so the tech and surgeon that walked in to let me know of the procedures even suggested I use soap to remove them. I was able to remove my rings and place them on the counter in the room before the tech took me to my procedure. When I returned from my MRI, I went straight to the bed. They gave me my medication for my severe pain, which made me drowsy, and I fell right asleep. I was so uncomfortable at that time, I honestly forgot all about my wedding rings. When I was comfortable enough to be clear again, I immediately went looking for my rings. They were nowhere to be found. Hospital says they are not responsible because tech said she did not tell me to take off my rings off. I am not sure which upsets me more, the fact that tech is lying or the fact that I have lost my rings and no one at the hospital is really putting much important to it. Just devastating. Hospital said they would do an internal investigation and review the cameras to see what they find for a report, claim, or restitution. I even pointed out to review footage that I went down the hall then in my room with wedding rings, and when going to procedure, rings were off. No response regarding this. The response they gave me after their investigation was, "This is Broward Health Coral Springs Security Department. I was calling to inform you that I included in the investigation, and I have found that no one had entered your room other than the medical staff while you were present. We are closing out your case." My surgery went well and I am recovering nicely. I'm very thankful to the surgeon and hospital staff in that regard. However, my wedding rings had obviously immeasurable sentimental value, especially since my father had made them for me. This whole situation regarding my rings disappearing from my hospital room has been disheartening. The lack of action from the hospital and quick dismissal has made this the situation all worse. They have refused to take any responsibility or offer any solution, even though, as they pointed out, only staff went into my room. 2 years ago, my wife and I went to the hospital with our 16-month-old son. He had a 104 fever and throwing up. We went to check in at the registration. The lady told us at the front to wait outside as there was no space for kids in the waiting area, as adults were waiting in the kids section. People were coughing all over the place and not wearing masks properly. We parked our car in the front of the ER to keep our son in the air conditioning. My son kept throwing up in the parking lot, and no one cared about our son being sick. I was told by a security guard to move my car. I advised the security guard that we were keeping our son in there because it was too hot for him to be standing outside in the Florida heat. He advised that we still cannot park there. However, not one thing was said to any of the people in the emergency room not wearing masks at all. After 45 minutes, I went back into the registration and asked what is going on. My son continues to throw up. My wife was covered in vomit. The registration lady even advised us that the children's ER was not crowded and didn't understand what was taking so long for our son to be seen. If you have a sick child, do not go there. Coral Springs Hospital, they are not prioritizing children, and they don't have a separate section for kids to sit. I have called multiple times to voice my frustration, but they don't care. I know that nothing can be done for my child, but I would hope that Coral Springs Hospital will do better in the future for children coming in the ER who need help, and have a section just for children who are unable to wear a mask or unable to get the vaccine, so they are not exposed to COVID-19, so they do not have to be exposed to the extreme elements of Florida. Thankfully, with further attempts to contact you, you were able to speak with our emergency department manager. We are confident the recommendations discussed will be implemented and monitored to ensure we continue to provide. Okay, wow, they really connect the review to what they did. Okay, a year ago. Worst hospital, especially for kids, came in with vomiting, headache, bellyache, and dehydrated. Doctor only did vomiting pill in exactly 5 hours, not even fluid. Nurse forgot to discharge me while they only did one vomiting pill. What a terrible hospital. My child's still the same while they did just nothing. Well, a year ago, the worst experience with the ER is going in with excruciating pain, not knowing what is going on with you, and bam, without a test or valid observation, forcefully discharged by the rudest charge nurse in the world. Backtrack, enter with pain, got to poke around by the doctor that prescribed a numbing GI cocktail, which didn't take the pain away, instead exasperated the headache. I was later told acid control meds were prescribed and I was discharged. Asked to see someone else because I felt I wasn't adequately treated. The charge nurse, Eric, has no people skills. You are discharged, repeatedly, proceeds to physically remove all vital equipment and take the cover off me. He physically threw me out. The Dr. Ruiz, female, nowhere in sight. I walked out the way I walked in, and for someone not too used to or expecting that, I was utterly shocked and dismayed. In unbelief of all my ER visits, either with family or me, I never have this level of care is appalling. If you had a bad day, that should not be reflected on me. I ended up coming home suffering through the pain until I could get the advice of my primary care. If 0 stars could be given, would have given that. 2 years ago. This is the worst hospital. I do not advise anyone on going there. I took my 1-year-old there with high fever and waited almost 3 hours in the lobby without assistance. Finally, a nurse came out to give him Motrin and sent us back to the lobby. After waiting for so long, I decided to leave and take him to Boca West. Turns out my son had pneumonia. This people charged me over $400 for simply taking his temperature. I called in to see why I received this bill and was told that since he went through triage, I was charged. And to keep in mind to next time take him to his doctor instead of the emergency, if his doctor works 10 p.m. on the weekend. A year ago, they have adults waiting in the children's ER, and after being in a room for over an hour and a half with an infant, turns out the radiologist and doctor on staff misdiagnosed my baby's leg injury. After following up with a specialist, I was told that my baby's injury was more serious than just foot pain, as she put on the discharge paper. Do not come to this hospital or any of their affiliates. Everyone has attitudes and does not care about the patients. It's not clean or ran properly. 2 years ago. Went to ER for chest pain. Was told I was going to be admitted at 1 a.m. At 6:15 a.m., still waiting on gurney to be transferred. I told them I wanted to leave. They gave me a paper to sign. I signed and wrote how long I had to wait. The nurse told me I was not allowed to write on the paper, so I threw the paper in the garbage. No one spoke to me about my issues. You would think that the charge nurse would at least talk to me about my issues. If I had not left, I would have more than likely waited until 9 a.m. or later, SMH. In the end, no one even recorded my medical history or what medical I take. During my 6 or 7 hour experience, they took my BP one time, even though it was very high during triage. SMH. 2 years ago. Would give a minus if I could. My husband went for a stomach bug he got. They told him I could go in the emergency room with him once he tested negative for COVID. He was feeling horrible, high fever, and dehydrated. Once the test came back negative, they refused to let me back there. although there are signs stating one person can accompany you if negative, along with them telling us that prior. Also, while he was waiting for hours, he asked for water and ice, which was refused. They were rude, made him feel uncomfortable, and accused him of using my urine because the front desk had him get a sample while waiting in the room. This was outlandish. He's sick and needs to figure out what's going on with him. Extremely unsatisfied with their service. Do better for people. You see signs everywhere. Best emergency room service. Definitely not. Going back home with no answers. Huge waste of time. 2 years ago. This was the first time and last time, if I can help it, that my son received post-operative inpatient care at Broward Health Coral Springs. Since he's post-operative, he's still ordered not to have anything by mouth, so he hasn't eaten in 7 days. Last night at 8:10 p.m., my son's father, only one parent allowed due to COVID, realized that the IV in my son's arm was leaking. After failed attempts and 3 hours of runaround, they were able to put another IV in his arm, only this time it wasn't in a vein, so the fluids were just infiltrated under the skin. At 3 a.m., they realized what they'd done and decided to remove the IV completely. At 7 a.m., I returned to relieve my son's father, and after a lot of noise making, 3 more unsuccessful attempts and 20-minute follow-ups, they had a nurse come from the outpatient to insert the IV in the vein properly, and she was successful the first time. By this time, it was 11 a.m., so he had been without proper fluids for 15 hours. My son is on the tail end of his stay, no dehydration, no other nurses, doctors ever had problem finding veins. I said all of this to say I don't think anyone on the pediatric unit is experienced enough to insert an IV into a child, and especially not during the nighttime, which is extremely concerning. After 12 hours, I'm sitting here waiting for a transfer because I no longer feel confident that the staff can provide an adequate level of care. Dr. Markley, Dr. Lasco, Dr. Vino, and Dr. Bishop are the best things that are happening in this hospital. A year ago, we lost our mom in this hospital. No attention, poor medical care. Doctor showed up 4 days later, kept her in ER for 24 hours plus, exposing her to viruses. Almost no doctor visits or calls, not even return calls. Incompetent staff and poor medical care all the way. Social workers not reliable, unresponsive nursing staff and doctors, and everyone should know all doctors are competent. Not all doctors are competent. Keep your loved ones away from this hospital. 2 years ago. Don't walk, run away from this hospital. I have requested to speak to the director of the hospital multiple times, and I get transferred all around the hospital to more incompetence. Gave birth to my son a year ago and still getting collection calls for items billed incorrectly. Forget trying to speak to the billing department, incompetent. I even got transferred to an administrator who said she would look into it almost a week ago. Nothing. I am over it. Never referring anyone here, nor am I ever coming back. Complete joke. 2 years ago. To update my horrible experience at this so-called hospital, not only did I not receive the care I needed, but this place billed my insurance for $14,000 for their wonderful service. Incredible. This is the reason why no one can afford health care. Not only did a physician never examine me while I sat in a room for hours, these charges are only for x-rays, CT labs, and IV observation. Disgusting, that is all I can say. Against my better judgment, because I heard this place was bad, I made the mistake to go to CSMCER at my doctor's request. In my 6 hours in a room at the ER, I was not examined by a physician. The nurses were rude and incompetent. CT was done because of my rectal bleeding. I had to walk to nursing desk several times to ask for someone to come to talk to me. Finally, a very rude nurse handed me the CT report, and still nobody explained my diagnosis. Very rudely, I was told my gastro told them to admit me, which I later found out from him was not true. Was finally moved to a room upstairs where things did not improve. For 40 minutes, I sat in a bed waiting for anyone to come check on me. My husband got there, and every question he asked, the staff just looked at each other, hoping the other would have an answer. Thank God I was not so ill that I was able to walk out of this so-called hospital. We need a real hospital in Coral Springs. Horrible, horrible. Who certified or inspected this place to be a medical facility? Be careful and never go to this place. 2 years ago, our 92-year-old mom was hospitalized 10 days after receiving the COVID vaccine. They told us she was COVID positive on 2/20. After our persistent request, she was tested again and tested negative 4 days ago. She also was clear for any other issues. Since then, we wanted her to come home or at least be transferred to a non-COVID area so my wife could be with her. Communication was non-existent. We would call several times a day just to be told they will get back to us. Nothing. She desperately wants to go home, but no one seemed to be able to make the decision. They throw the ball at each other. They say they'll call back and never do. This has been one of the worst experiences of our lives. We had no choice but to go in person and to push, and finally we got answers and she is coming home. You judge if you would like to go there for care. On a side note, we still don't know how she could have contracted the virus, except for the time we took for her to get the vaccine. We sheltered her to the max, and also we all tested negative. Go figure. Update. We finally got our mom home, and the negligence is evident. Shame on them. Never again. 2 years ago. If you have an emergency, don't come here. Super crowded at the ER, which is always a bad sign. Understaffed for an ER. They spent all the time for registration just to wait and wait and wait and wait. Yes, lots of people. There were at least a dozen people in the lobby just waiting for someone to see them, probably for hours already. Emergency for you is not an emergency for them. Forget about it. They will get to you when they can. It's a test of patience to be here. I called around to other hospitals to ask about ER wait time. We left after waiting 20 minutes and went to Coconut Creek ER and admitted right in and was escorted to our room in less than 2 minutes. Wow, night and day. Broward Health Coral Springs gets a F, 0 stars if that's possible. A year ago, the worst. Someone in the room across from me had COVID and just tested positive for, I don't know if the guy was her nurse or doctor, but he yelled it from the door and he was very loud, so I heard everything. After the lady left, someone went to clean the room. The same guy then yelled from the other room, "Oh, she has COVID." The lady looked at him and he said, "Just letting you know, I don't care," and all she did was change the sheets, then rolled another patient in there. My nurse was everywhere without a glove, even pulled my mask down to give me pills. Disgusted. Isn't that a HIPAA violation? Going to get tested in a few days because I hated how my nurse pulled my mask down and took my IV out without gloves. Don't go there. 2 years ago, the worst experience of my life. The things that happened are too numerous to name, but I nor anyone in my family would never step foot in this so-called hospital ever again. The experience was a complete disgrace, and the lack of service and compassion was something I have never ever seen before. Shameful. They are lucky they aren't being sued. A year ago. Terrible care. They don't answer the phone. Sometimes I had to let it ring for 15 minutes and hung up, called again, and waited another 15 minutes. Doctors are often impossible to reach. On-call number. Didn't even know that the doctor I called was working at Broward Health Coral Springs. Patient had to wait 30 minutes for a bedpan. 2 years ago. Worst hospital. They have almost no nurses at night. My daughter called the nurse 100 times last night from 9:30 p.m. until 6:30 a.m. and was never answered, nor anyone came to the room. She finally came with a bad attitude at 6:40 a.m. saying that they don't have nurses and left. Nobody showed up for 9 hours. My daughter had to disconnected everything to go to the bathroom herself without any help. Her IV machine was beeping all night. This is 100% unacceptable. No water to drink, nothing for 9 hours. It is criminal. Today I am going to escalate and complain and call authorities. I will find out the names and post it later on. 2 years ago. The worst hospital I've even been to. Please stay away from this place. I was there for a week and they never cleaned the bathroom with garbage overflowing, and I think they got some kind of funding if they intubate a person, especially Hispanic, that doesn't understand what's going on. Keep your family safe and do not take them to the hospital. 2 years ago. Why did they not clean their bathrooms / replace sheets for their patients? It's funny how some things are just repeated over and over again. So, that concludes the reviews from Broward Health Coral Springs.
Broward Health Coral Springs is a 250-bed hospital located in the heart of Coral Springs, providing high-quality care for patients and their families for more than 30 years, focusing on emergency, surgical, women's, and children's services. When it comes to emergencies, you can count on Broward Health Coral Springs for 24/7 access to specialized emergency room physicians, including board-certified pediatric specialists and specially trained medical teams. There is a dedicated children's emergency department providing patient-centered care for the youngest patients. It is also the first area hospital to offer telemedicine, giving patients the ability to electronically communicate with medical caregivers. The Surgical Center at Broward Health Coral Springs is committed to providing patients with high-quality, medically innovative care. The center offers the latest in minimally invasive and robotic treatment options in a variety of specialties. Some of the benefits of minimally invasive surgery can include less pain and scarring and shorter recovery time versus traditional surgery. The Sala Foundation Children's Hospital at Broward Health Coral Springs offers the full spectrum of pediatric specialty services in a cheerful and uplifting environment. With access to specialized pediatricians and pediatric nurses, patients can benefit from an extensive range of inpatient and outpatient pediatric programs, including a 24-hour dedicated emergency room for children and West Broward's only pediatric intensive care unit. The Women's Hospital at Broward Health Coral Springs features a vast array of specialties, ranging from general gynecology and obstetrics to gynecologic urology and cancer care. Services include breast MRI, digital 3D mammography technology, osteoporosis detection, stereostatic breast biopsy, and ultrasound. Educational resources are also available, allowing women to gain control of their own health and wellness. The maternity place at Broward Health Coral Springs offers high-quality, personalized obstetric and level 2 neonatal care, all in a comfortable, modern environment. All new private suites and comprehensive support services for both mother and baby are just a few of the unique amenities. For babies requiring a higher level of care, parents can feel comfortable knowing it's on-site through the Sala Foundation Children's Hospital. The Level 2 Neonatal Intensive Care Unit is staffed 24/7 by board-certified neonatologists and highly skilled neonatal nurses ready to care for the most specialized cases. The all-private suite NICU is located steps away from Mom Suite, offering increased privacy and enough space for the entire family. Broward Health Coral Springs has a long-standing history and commitment to the community. When looking for high-quality, compassionate care, you can depend on Broward Health Coral Springs.